Hi friends, I am Dr. Rahul Bhargav, Director of Hematology and Bone Marrow Transplant, and heading the largest and the biggest team for hematology and genetics and infectious disease specialists in this similar team at Fortis Memorial Research Institute. So today we are going to talk about bone marrow transplant. Bone marrow transplant is a simple procedure of blood transfusion. Yes, it seems so simple, it's not a surgery, but yes, who makes it simple is a group of 12 doctors working together at FMRI for you. It is first is of two types, autologous or allogenic. Autologous is self, means you have to collect the stem cells from yourself and you don't have to break the bones, you don't have to do any surgery. So it's a blood transfusion kind of a thing where you have to collect the stem cells from the biggest vein. And either this vein can be in the jugular vein, that could be in the femoral vein, or it could be in the hand. So you collect 300 ml of stem cells, which comes after giving injection GCSF for 5 days. You collect it, keep it, and do the autologous bone marrow transplant for multiple myeloma, lymphomas, peripheral T-cell lymphomas, B-cell and T-cell lymphomas who have relapsed, or certain T-cell lymphomas who are high risk and needs to be consolidated with transplant. And of course, Hodgkin's lymphoma, people after first relapses, they need to get a bone marrow transplant. Then comes the allogenic transplant. Allogenic transplant is of three types, which is from the sibling, which is like brother or sister. And the first thing which is required for an allogenic transplant is HLA. I will repeat, HLA and not blood group. You always confuse that we need to have a blood group match. No, we are all HLA. So that is available in the country. So you can just take a cheek swab, rub it inside your cheek and send it across, which contains your DNA, and you can find out whether there is a match. In a brother-sister, there is a 30% chance that you will have a full match. But if you don't have a match, there is another kind of a transplant which is called as match unrelated donor transplant. So my high resolution, mark the word called high resolution HLA is required and not the low resolution. High resolution HLA is required to search for the mud, and that can be put on the registry. The average time to get a donor is 2 to 3 months, and the cost depends upon the various registries where it is coming from. US is like $50,000, but in Germany or Britain it is like around 8,000 to 10,000 euros. And once the stem cell comes by, you can do the bone marrow transplant, which is called as match unrelated donor transplant. But the chances is in 150,000 to 180,000 to find that match, which is rare, very rare. If you don't have that, now at Fortis we have discovered a new way called half match transplant, which is very, very peculiar. And the state-of-the-art haplotransplants in across India is being done at Fortis Memorial Research Institute by a group of team of 12 doctors working together, which has got IT specialists, geneticists, geriatrics, critical care hematologists, physiotherapists, nutritionists, 4 hematologists, adult and 4 hematologists on a pediatric side. So half match transplant means that transplant is available for all. I mean, you will have a half match, either from your brother or sister, from your son or daughter, or your mother and father. They're always there. And at our center, we tend to prefer male donors and not the female donors because of lower risk of GvHD when the male donors are being utilized. Average length of stay in bone marrow transplant in autologous transplant for multiple myeloma is 14 days. Yes, 14 days in India. For lymphoma, it is 21 to 25 days. For an allogenic transplant, 21 to 25 days in the hospital and 3 months outside. And please do not come in a hurry. Stay with us for 3 months because that will provide you for next 30 years of life. Because we know that we can remove blood cancer through the means of bone marrow transplant. And what we are doing differently from the rest of the world is the depth. Understanding your disease based on the genetics, which will help us in knowing how much long we need to give the therapy to you. 3 months, 6 months, 9 months. How long for you to follow up, 1 year, 2 years, 3 years or 4 years. And that is how this genetically inspired bone marrow transplant and precision medicine is helping to reach and achieve 80% of success in bone marrow transplant. So I would request all of you, need not worry. And the indication is very, very simple. Multiple myeloma, lymphoma, leukemias, acute myeloid leukemia, acute lymphoblastic leukemia who has relapsed, myelodysplastic syndrome, aplastic anemias, and what is new for all of us is very, very peculiar thing, is autoimmune disorders like multiple sclerosis or systemic sclerosis. So, believe in us, see through our profiles, and most happy to win together and giving an opportunity together to win over blood cancer. Thank you.